Welcome to the Virulent Vortex, a podcast in which we discuss infectious diseases across scales, from pathogens and molecules to populations and pandemics and everything in between. My name is Jaap de Rode. I'm a professor of biology here at Emory University. And with me today is Liz Rogawski McQuade, who is an assistant professor of epidemiology in the Rollins School of Public Health here at Emory. Liz, welcome to the show.
Thank you so much for having me.
So Liz, you joined Emory actually quite recently in the last few years, and you're mostly focused on understanding antibiotic resistance. Can you tell us a little bit about that research project?
Sure. So we're specifically interested in looking at antibiotic use in children in low-resource settings. Children who have overt diarrhea illnesses are frequently treated with antibiotics in these settings. And we're interested in how that use can translate to antibiotic resistance. Mm-hmm. It's quite hard to make that link between sort of individual use and population-level resistance.
Yeah.
And we are focusing on one piece of the puzzle, which is how antibiotic treatment for viral diarrhea episodes and parasitic diarrhea episodes can contribute to antibiotic exposure to bacterial pathogens.
Okay, so let me ask you there. So you said viral infections and parasitic infections, but antibiotics should only be used against bacteria. Isn't that right?
Yes, that's right. So this is a huge problem, really globally, but especially in low-resource settings, mm-hmm. where point-of-care diagnostics aren't available for diarrhea.
Okay.
So a patient comes in with diarrhea, and it's very difficult clinically to distinguish viral from bacterial episodes.
I see.
The WHO treatment guidelines recommend treatment only for bloody diarrhea, which is more likely to be bacterial. Mm-hmm. However, very few episodes are bloody. Okay. And so because of the demand for antibiotics and the clinical suspicion for bacterial diarrhea, antibiotics are widely used in practice.
Yeah.
We've shown for more than half of episodes in the community and almost all hospitalized diarrhea cases. Yeah. So the vast majority of antibiotic use for diarrhea is actually inappropriate because it's going to treat viral and parasitic episodes. Yeah. One research site where I work quite closely with is a place called Hainan, Tanzania. Mm-hmm. It's in north central Tanzania, and it's quite under-resourced. It's a rural area, primarily agricultural based on subsistence farming.
Okay.
There is a regional hospital, a referral hospital where we work, but otherwise access to care is quite limited. Access to improved water and sanitation is quite limited. There's a high prevalence of malnutrition and stunted growth in kids. So, really quite resource limited settings.
Right. Yeah. And so what you were describing is that it's hard to diagnose the pathogens that are causing diarrhea, and therefore these children are often prescribed antibiotics. And that's not because the doctors know they shouldn't. It is because they just cannot tell whether it's parasitic or viral or bacterial.
That's right. And that occurs here in the U.S. as well.
Mm-hmm.
There's frequent overuse of antibiotics for diarrhea here. There's high demand from the patients.
Right.
There's incentives for prescribing to occur. In some settings, like in South Asia, antibiotics are widely available without prescriptions.
Oh, okay.
So it's very easy for caregivers to access antibiotics without a diagnosis or prescription.
Right.
So, in general, there's just a high demand for antibiotics, and they're widely overused.
Yeah. And so the overuse of antibiotics carries risks with it. And so that is what you are studying.
Absolutely. So we're worried about overuse of antibiotics in terms of resistance. Mm-hmm. There are several diarrhea pathogens that are sort of on the WHO priority list for antibiotic resistance, including Shigella and Campylobacter and pathogenic E. coli. But we're also, of course, worried about these unnecessary antibiotic uses affecting asymptomatic infections with bacteria at the time of treatment. So even if a child comes in with rotavirus diarrhea, for example, they get prescribed antibiotics, one might naively assume, well, it doesn't matter. The rotavirus isn't going to become resistant to antibiotics. Who cares?
Yeah.
But the problem is that asymptomatic infections with enteric bacteria are very common in these settings. And so...
Right. And so then those bacteria that are not necessarily causing disease at that moment could become resistant to antibiotics. And then when it starts causing an infection, either in that child or someone else, they would be hard to treat because they're now resistant to the antibiotics.
Exactly. Yeah. We think most likely there might be exposure to the pathogen in a child while they're asymptomatic, and then that gets transmitted to another person and could cause resistant disease.
Yeah. And so when you're studying this, At what kind of levels do you find that when this happens more often, that there is more resistance, say in a town or in a region? At what level do you study this, and what evidence do you find?
Yeah, so as I mentioned, it's very hard at the individual level. You don't usually see that antibiotic use in an individual corresponds with resistance in that individual. The development of resistance is really more of a population level phenomenon. But we do see at the level of our study sites, which is a relatively small geographic area, for example, the catchment area of a single hospital, you do see that rates of antibiotic exposure and this exposure to asymptomatic pathogens is correlated with the prevalence of resistance at that site.
I see, right. So that's really clear evidence then that the overuse of antibiotics causes or is associated with this resistance. So knowing that, what can we do about it?
Well, antibiotic stewardship interventions are extremely important. Unfortunately, they are not hugely successful. It's hard to get clinicians and caregivers to follow treatment guidelines and reduce antibiotic use. I'm very interested in understanding the potential impact that enteric vaccines could have on reducing antibiotic use. So the idea would be, if you, for example, have a rotavirus vaccine, you prevent the rotavirus diarrhea from happening. That prevents the indication for antibiotic use.
All right, Liz, it was really wonderful talking to you, learning about your project to understand this antibiotic resistance. And good luck with everything you're doing going forward. We hope you enjoyed this episode, and we look forward to seeing you again. Thanks for watching.